This is one of the things that can be very frustrating when you're feeling like something is wrong, but or your labs are coming back normal, right? Everything looks fine on your blood work, but you feel terrible. Um, that's something that I see quite a bit in my practice. Hi, my name is Dr. Asay. I'm a primary care physician in Nashville, North Carolina. I mainly see a lot of patients that are going through perimenopause, menopause, that really are looking to gear towards longevity or improve their cardiometabolic health. And this is the kind of patient that I see a lot in my office. So just very quick patient case. We have a middle-aged 44-year-old female that came into office with main concern is just fatigue, hair loss, skin is changing, just feels tired all the time. And a lot of the times, it's, I'm mom, I'm working. So we kind of brush that all off as that. But this has been going on for about 18 to 24 months. And nothing that she's been doing is improving her symptoms. So she's had workup before with a CBC that was practically normal, and she was told everything looked fine. The slight things noticed on her CBC was her MCV was a 78, her MCH was 23. Her complete metabolic, comprehensive metabolic panel looked great. CMP was normal. Her thyroid with a TSH was 2.1. Free T4 was normal as well. Vitamin D was great. It was 58. She's had a B12 level. It was excellent, 720. She even had some hormone labs, which is, not something that's very typical to order during perimenopause, but she had some hormone blood work done in the past, which were consistent and appropriate for where she was supposed to be in her cycle. But she had been started on HRT to see if that would help with some of her symptoms. But it's been a year later and she's still feeling very exhausted. And now she's noticing that her hair is falling out a little bit more than usual. But every time that she'd have blood work done, everything was coming back normal. And, she wasn't necessarily getting anything that was abnormal to address while she was feeling that way. But on reviewing the labs, one of the most common things that I think we forget to add to a panel when we're evaluating fatigue, even with a normal CBC, is an iron panel. When we checked your iron panel, her iron was 36, her percent saturation was 10%, and her ferritin was 8. So an 8 of ferritin will make anybody feel terrible. The reference range is 15 to 150. But we all know based on research that 15 is actually not where you want to be. Yes, it's considered normal on the lab work, but it's still very low. You want your ferritin level to be ideally anything above 50, 60 in some cases to even have some good iron storage. So, when we started replacing her iron, she noticed improvement in her energy level. But replacing iron also takes some time in terms of increasing your diet for iron-rich foods, but also taking an iron supplement. And in some cases, some patients are really fatigued and even having other symptoms like shortness of breath, which was not the case with our patient here, but some patients can have shortness of breath. And in that case, you have to really figure out, can you do another replacement form of iron, like an iron infusion, to try and get them back up in terms of replacement. So this is just to say, when we are evaluating patients, especially middle-aged patients with moms working, they have a lot on our plate, we really have to make sure that we're doing a full, complete workup. And she had most of the blood work checked, but an iron panel is really important, even if a CBC is normal.